Providing and responding to ADL needs. What are activities of daily living, or ADLs? These are the terms used to refer to people's daily self-care activities. There are 6 which include eating, bathing, dressing, toileting, mobility, and transferring. First, let's start with feeding. Assistance with eating may include supervising the client when they are able to feed themselves, assisting with difficult tasks such as cutting food or buttering bread, and feeding the client when they are unable to feed themselves. Sometimes you will have to remind your client to wash their hands or assist them to wash their hands before eating. For clients who are unable to feed themselves, please keep the following in mind. Transfer them to a chair to feed whenever possible for safety. If feeding must be done in bed, make sure the client is sitting up at 90 degrees. Drape the client with a small towel to protect their clothing from spills. When reaching for a cup, do not touch the rim, as this will touch the client's lips or mouth. Watch to make sure they swallow the first bite before offering another bite of food. Try to alternate between offering food and offering something to drink to facilitate or help with swallowing. Some clients may have difficulty swallowing or dysphagia and may need softer foods or thickened liquids, as thin liquids run too fast down the throat and could get into the trachea, causing choking. Assist to clean the client's face and hands after feeding with a warm, wet hand towel. Next, let's go over bathing. Helping a person with bathing requires extra sensitivity to their privacy and dignity. You may work with clients who require no assistance with bathing. Keep your eyes and ears alert to the possibility that it is no longer safe for your client to do so on their own. For high fall risk clients, it is recommended that they sit to shower. Stay close and gently support them on the sides as they get in and out of the shower. Some may need hands-on assistance with some of the more difficult tasks of bathing, such as washing areas that have become too difficult for them to reach. For clients on complete bed care, they will require daily sponge baths in bed. For clients who are on hospice, hospice agencies will send a bath aide to assist with a 2-person transfer 1 to 2 times a week so that the client may get the hygienic benefits of a shower. Dressing. As with most ADLs, there are different levels of assistance when providing help with dressing. Some clients will require no help at all. Some clients will require assistance with the more difficult tasks of dressing, such as buttoning or putting on stockings, and others will require full assistance dressing due to their limited mobility or immobility. Special considerations will need to be taken when dressing a client with a one-sided weakness, like a stroke patient. When undressing, start with the unaffected or strong side. For example, help the client remove their stronger arm first from the sleeve of their shirt. When dressing, start with the affected or weak side. For example, slip the shirt sleeve over the client's weak arm first before slipping it over their head and other arm. Be sure you support the weak arm while you do so. Toileting. You may have to provide continence care, which is care for clients who still have the ability to hold back their bodily functions. They may only require assistance transferring to a toilet or commode, removing articles of clothing and putting them back on, performing perineal hygiene due to their limited mobility, and assistance to wash their hands. You may also need to perform incontinence care. Incontinence care is the care of clients who no longer have the ability to hold back their bodily functions. They will require wearing incontinence products such as Depends or adult diapers that will need to be changed when soiled. Urine and bowel movements are very harmful to the skin, so prompt changing and proper cleaning are important for good skin health. Mobility. Assistance with ambulating. Sometimes we will be required to supervise the client when they are walking on their own or with the help of a device, such as a cane or walker. At times, we will be required to help with difficult parts of walking, such as climbing stairs. Providing constant physical assistance is important to those who cannot walk alone. If the client starts to fall, help support the person, but don't try to break the fall. It may cause injury to yourself. It is better to support the head and gradually ease the client onto the floor. Be sure to keep your feet apart and back straight. Pull the client close to you and let them slide down to your body as you ease them to the floor. Often, you will also ease yourself down with the client. Transferring. Transferring people involves helping them move from one place to another. It is important to know how to do it the right way to make sure that neither you or the person gets hurt in the process. Positioning and turning. Many people must remain in bed because of an illness or weakness. Correctly helping a person into a comfortable position is important to keep them healthy. Repositioning or turning at least every 2 hours will prevent the development of pressure sores. Transferring clients. Many will require some level of assistance to transfer in and out of a chair, wheelchair, or bed. Level of assistance depends on how much the client can help with the transfer. Some may need a little help getting to their feet, while others may not be able to use their legs to help at all. Devices may be necessary, such as a gait belt or a Hoyer lift, for safety. By the end of this presentation, you will see a video on how to properly reposition and transfer a client.